We have one last presentation in this session. It's going to be a remote connection. So hopefully Maria can hear me and we can hear her and see her. Let's see if this works.
Hi, I can hear you.
Very well, very well. Maria is a cybersecurity officer at ENISA. ENISA is the EU agency for cybersecurity, and she's leading the activities related to healthcare sector. So very much in line with our today's session here in Riga. So Maria, the floor is yours. We are ready to watch your presentation.
Thank you, and thank you very much for the introduction and the invitation to be here today. Due to conflicting obligations, I couldn't be there with you. Sorry for that. I wish I could be there and find out more about the implants as well. It was a very interesting presentation. Moving on to the next slide, I am here today to discuss the EU policy and regulatory framework for healthcare cybersecurity, the relevant cybersecurity challenges in the sector, including threats and risks, and of course to outline ENISA's activities in health. The first section of this presentation in the next slide is an overview of the applicable EU policy and regulatory framework that relates to the health sector. In the next slide, the first EU law to introduce the baseline cybersecurity requirements is the NIS directive. The directive identifies sectors of essential services relying on information and communication technologies that are necessary for the functioning of the society and the economy. And as you might know, the NIS2 is in force since January 2023, and the member states need to transpose these requirements into national law by October 17th, so in a few weeks. Now, the implementation of the NIS2 is expected to result in more entities identified as essential and important, and this introduces complexities. Under the NIS directive, there's the NIS cooperation group, which facilitates collaboration within the Union with participants from the national competent authorities, the EU Commission and ENISA. And the cooperation group deals with strategic governance of NIS implementation. So its work is organized into several work streams that address NIS implementation issues. And one of the work streams focuses on health. This work stream was chaired until recently by Portugal. And this spring, we welcomed Denmark, Romania, and Hungary as co-chairs. I don't think Latvia is represented in this work stream, if I'm not mistaken. I haven't seen anyone from Latvia. Now, moving on to the next slide, the NIS2 directive, as mentioned earlier, it applies to entities classified as essential and important for the functioning of the society and the economy. So these entities are required to comply with the requirements, such as to implement appropriate cybersecurity measures, incident reporting, and cooperation with national authorities. The health sector is in the scope of the NIS directive, and it does include entities that could be identified as essential and important, such as hospitals, clinics, public health departments, emergency medical services, and so on. And now what's new in NIS2 is that the manufacturing sector is included, which in turn includes medical devices and in vitro diagnostic medical devices. Another key piece of the EU policy and regulatory framework in the next slide is the medical devices regulation, the MDR. The MDR defines the safety, security, and IT security requirements. So overall, it aims to ensure that medical devices are safe and effective, and that the patients are protected from harm. And the regulation imposes strict requirements on manufacturers of medical devices, and it introduced requirements relating to cybersecurity, such as the reporting of vulnerabilities and incidents, risk management requirements, monitoring of the device's performance before they enter the market and during their lifetime. So the manufacturers need to comply with these requirements. Along with the MDR, in the next slide, a guidance on cybersecurity for medical devices was issued that provides, well, guidance for manufacturers of medical devices on how to implement the cybersecurity measures to protect against the risks that could affect the safety, security, or performance of medical devices. I should note that this is merely guidance. It's not binding. However, conformity assessment bodies do use it for their reviews. And it covers various aspects such as risk management, security features, incident response, and the monitoring of the security throughout the life cycle of the devices. Apart from the NIS and the MDR, in the next slide, we can see the rest of the regulatory framework applicable to the sector. One piece of the framework is the Cyber Resilience Act, the CRA, which is still in proposal stage. And the CRA defines the rules for placing on the market of products with digital elements to ensure that they are cyber secure. So the text was published, I think, in late 2023, and it's expected to be adopted in the near future. And even though it explicitly excludes medical devices falling within the scope of the MDR, it introduces cybersecurity requirements and incident notification requirements for other products with digital elements used in health. Another piece of the regulatory framework is the AI Act, which also includes requirements that are relevant to health. The AI Act aims to, first of all, I forgot to mention that it was approved by the Council in May, and it aims to regulate the development, deployment, and use of high-risk AI systems, which in health could be AI systems that are used as safety components, for example. And it includes several cybersecurity provisions, again, such as incident reporting and risk management. So many medical devices that fall within the scope of the MDR will likely qualify as high-risk AI systems. And finally, there's the EU Health Data Space, which also includes cybersecurity requirements, specifically for the healthcare record systems. So compliance requirements and, again, incident notification obligations will be introduced for products used in health. The Council will formally adopt the EU Health Data Space, and it's expected to be published in this autumn, if I'm not mistaken. But it will then become applicable in different stages according to use cases and data types. And the aim of the EU Health Data Space is to create a secure cross-border exchange of health data within the Union. One example is, for example, I'm from Cyprus, currently living in Greece, and I was recently in Spain where I fell ill and needed to go to the hospital. If the EU Health Data Space was in force, the hospital would be able to access the medical history, images, reports, results, laboratory results, and therefore the decisions and diagnosis, the treatment would be based on a broader set of information. And of course, the prescription information could be shared and could be used back in Greece, in Cyprus, or anywhere else in the Union. Moving on to the next slide and to the next section of this presentation, here I will describe the information sources we have at ENISA and the cybersecurity threats and challenges we have identified in health. So in the next slide, there are the key cybersecurity challenges relating to the sector as per the information we have collected from many sources over the years. I say this all the time, but if you have attended any of my presentations before, this slide remains the same for years. Sadly. It seems that there's a global increase in ransomware attacks in healthcare organizations that remain targeted, sophisticated, and coordinated. And unfortunately, it's estimated that the sector will continue to be heavily targeted by ransomware groups. There's also a global rising trend in health-related data breaches. I will go into a bit more detail later in the presentation. Of course, there are supply chain attacks that are also increasing, and they are introducing the potential propagation of infections such as ransomware. There's low cybersecurity maturity in the sector and lack of security awareness in healthcare organizations. We've also noted that many legacy systems are used in the sector, such as systems that lack security patches and updates, or maybe outdated medical equipment. And of course, not just in health, but in cybersecurity in general, there's a shortage in skills. But in health, I would say that there's a shortage of resources in general, which of course results in insufficient cyber threat and risk management. In the next slide, you will see some headlines from recent ransomware incidents. I'll briefly describe one that happened in February 2024 in Romania. Over 100 Romanian hospitals were forced to turn to pen and paper, which usually happens when a ransomware attack is launched. This attack was launched on a widely used healthcare management system, initially on 25 hospitals where the files and databases were encrypted, and other facilities using the CERT platform were disconnected from the internet as a precaution. This affected, among others, it affected children's hospitals and emergency hospitals. However, fortunately, recent backup copies were available for most of the targeted hospitals, and therefore the impact on the actual facilities was reduced. But the impact on patients was profound, as many more hospitals had to go offline as a precaution. So just to give you an understanding of the size of the attack, Romania has a total of 550 hospitals nationwide, more or less, and 20% of them were offline. And as mentioned earlier, it seems that the sector will continue to be heavily targeted by ransomware groups. Moving on to the next slide, under the NIS directive, the member states report incidents through ENISA's Cybersecurity Incident Reporting and Analysis System, the CIRAS system. So as you can see, as per the incidents reported through the past 4 years, health is in the lead, followed by banking and energy. And specifically for 2023, 29% of the reported incidents related to health, And if I'm not mistaken, for 2022, this was 32% of the total, which is a huge percentage. Moving on to the next slide, the nature of these incidents reported by member states mainly related to system failures and malicious actions, like in the past 4 years. And the underlying technical causes mainly involved software bugs and DDoS attacks. This other category here relates mainly to supply chain incidents. And now moving on to the next slide, we have published a threat landscape specific to the health sector last summer in July. So the collected incident-related data were from publicly available resources spanning from January 2021 to March 2023. And the scope of this sectorial threat landscape was the entire sector on the basis of NIS2. And we considered mainly threats relating to malicious actions. So I should note that the map illustration here depends on the collected data. So it could be that there are more sources available from some countries or language barrier. It doesn't necessarily mean, for example, that France had the most, more incidents. Now, this analysis in the threat landscape for health dives into the impact at EU level and includes information such as the observed incidents, prime threats, actors, motivation, impact, and it proved to be useful to both the national authorities and the entities under NIS. In the next slide, we have the threats and entities affected. So in the first graph, the types of threats identified during the reporting period were mainly ransomware and data-related threats. I should note that one incident might be classified into more than one categories, and that's why the total percentage does not add up to 100. And in the second graph, you can see a breakdown of the types of health organizations that were targeted during the period, which were healthcare providers and especially hospitals. These were the most affected. In the next slide, we have information on threat actors. On the first graph, you see the categories of cybersecurity threat actors considered in the analysis, which were cybercriminals, hacktivists, insiders, and unknown for the cases in which that these types of actors were not identified. In the second graph, for the analysis of these incidents, the motivations that we considered were financial gain, ideological, espionage, and other when the incident was unintentional. So you can see that during the reporting period, the threat actors mainly related to cybercriminals motivated by financial gain. And in the next slide, we see the impact of the incidents. So the first graph, in terms of assets, patient data and electronic health records were targeted the most. And as for the consequences in the second graph, it seems that breach or theft of data is the most common. Again, one incident might result in multiple consequences, and these might not add up to 100%. In the next slide, some more information on the impact. This graph shows the entities that the data breaches specifically have affected. So primarily hospitals were affected again, followed by pharmaceutical entities and health authorities, bodies and agencies. Moving on to the next slide in the third section of this presentation, At ENISA, we've been working in health for a number of years now, so I will briefly take you through our contribution in healthcare cybersecurity. In the next slide, we have the NIS investments report. We report annually on NIS investments by the entities. And the report issued in 2022 included a deep dive in the sector with health entities, more health entities being surveyed, and additional sector-specific questions asked on medical devices, cloud, and cybersecurity awareness. And in the next slide, we can see the results on medical device security. The survey data indicated that 64% of the entities in health were using connected medical devices in their operations, and 38% of them did not have any specific security solution deployed for these connected medical devices. In the next slide, we see the results for protection against ransomware. So when these entities were asked whether they have a dedicated ransomware defense program, which means whether they had dedicated resources and budget, the responses indicated that 44% of the entities do not have a dedicated ransomware defense program in place. And with regards to awareness raising in the second graph, or training programs for non-IT staff, the health entities' responses indicated that 33% of them have no awareness program at all in place for non-IT staff. And in the next slide, as per the surveyed organizations, you see that health is the fourth sector, was in 2022 at least the fourth sector with the highest average direct cost for major cybersecurity incidents, right after banking, energy, and transport. Now, in the next slide, there's another interesting publication by ENISA, the one on engineering personal data sharing. This one includes use cases relating to personal data sharing, primarily in health, and how specific technologies and implementations can support data protection, and of course the challenges in personal data sharing, and how to engineer specific technologies in order to enable privacy preserving data sharing. In the next slide, there are some additional reports that we've published over the years, such as the one on cybersecurity and resilience for smart hospitals, the one on procurement guidelines for cybersecurity in hospitals, and the one on cloud cybersecurity for healthcare services. All the reports mentioned are, of course, available on ENISA's website. In the next slide, you have information on the annual Health Security Conference. So in order to bring the healthcare community together, we organize this conference on a yearly basis. This year, the event will be hosted in Budapest on November 6th, and it will focus on the aspects relating to the implementation of the NIS directive in the sector, other policy developments in health, and in the same context, it will also include sessions dedicated to the constantly changing threat landscape. You can check more details on our website, and if you're interested, I invite you to register as soon as possible, since the capacity of the venue is limited. In the next slide, we have another initiative, which is the EU Health ISAC, which is chaired and driven by the CERT in the Netherlands, and ENISA is a board member. The membership for the ISAC is free of charge. However, travel and accommodation expenses are at the members' cost. Healthcare providers and CERTs or CSERTs can become members of the ISAC, and I have included the Secretariat's email address in case you are eligible or you know someone who who wants to join the EU Health ISACA. In the next slide, there's another important initiative, the Cyber Europe exercise. It's the Pan-European Cyber Crisis exercise organized by ENISA. This one I have here was executed in 2022, and the scenario focused on the healthcare sector, and it aimed to test resilience of the healthcare services in Europe. So the scenario included real-life inspired technical incidents that built up into a major crisis. And as per the after action report, which is also available on our website, and I have included the link here, the findings confirmed more or less what we had already known for the sector. For example, that smaller entities struggle when it comes to cybersecurity. There's a need for frequent testing in order to improve and strengthen the resilience of the sector. It confirmed the importance of sufficient budget and resource allocation. It also confirmed that awareness raising for cybersecurity threats and risks is critical for the entities in general, but especially for the medical and clinical staff. The silver lining, though, is that the exercise provided the opportunity for the entities to prepare for a real emergency. They had the opportunity to share the gaps they had identified with their upper management and stress the need for future investments in cybersecurity resources. Currently, we are exploring the possibility to reuse this material from past Europe exercises to design and execute smaller and custom exercises, for example, at national or regional level. In the next slide, we have information on the awareness raising campaign for health, which was launched together with Cyber Europe back in 2022. And it's part of a 3-year plan up to 2024. And the material includes videos, illustrations, infographics, which is, of course, uploaded on our website. And if I'm not mistaken, is translated into 5 languages. I don't think Latvian is one of them, though. But the material could be used in your organizations and could be disseminated further, of course. In the next slide, we have another important initiative, the AI in a Box that we've developed. It's a framework for building an awareness culture, and it includes the steps to prepare a custom awareness-raising program. Since the material is sector agnostic, and it includes templates for media campaigns, infographics, posters, quizzes. It could be used in any way or form you'd like to prepare your awareness raising program. A game is also included in the box, complemented by a guide on how to play the game. We've tried this game in several audiences so far, and people are really interested in finding the solution. It's intriguing and engaging. And there are 3 versions of the game. A tabletop version, which is 1 hour long, a presentation kind of version for bigger audience, which is 1 hour long, and a shorter version, the mini game, which is half an hour long. And in the next and final slide, I would like to conclude by mentioning, as you probably already know, that cybersecurity threat landscape is highly influenced by unstable geopolitics, disinformation, and sophistication. Of course, the health sector is critical, and must be protected from the cyber attacks. As mentioned, there's a need to increase investments in cybersecurity in order to ensure the resilience of the EU critical infrastructure in general, but the health sector specifically. I'd like to also reiterate that awareness at board level is crucial and will improve the maturity and drive these cybersecurity investments. Of course, staff awareness and training is key, and especially for medical and clinical staff. But again, the silver lining is that the coexistence of several cybersecurity regulatory developments at union level require the cooperation and support by member states and the private sector. So these new regulations, policies, and standards are setting the framework. And of course, information sharing and increased cooperation between all the stakeholders in the sector is crucial. So this concluded my presentation, and thank you very much for your attention. I tried to be cautious on time. I'd be happy to take any questions if there's enough time.
Yes, we are over time a little bit, but a few questions that came from the audience. You mentioned the attacks on hospitals, which is a horrible thing to do if we consider, human mind and what it's capable of doing. What about patients? Were there any patients' lives in danger because of these attacks?
One of the findings of the threat landscape that I mentioned, the one for the sector, was that the entities are very reluctant to share such information. So the information we have on that is limited. There were some incidents that patient safety was compromised. There was one incident that resulted in death, but it was never confirmed that it was the result of the cyber attack, of course.
Right.
So yeah, unless the entity is reported as such, we don't have any information.
And attackers don't have it as well, then probably it's a wise thing to do. I'm just speculating here. Another question that came in, what to do with the medical device that has leaks in terms of its cybersecurity?
This is a tricky issue. Hospitals usually, as mentioned earlier, they have a wide range of devices that many of them could be either outdated or could be lacking patches. And understandably, since they lack resources, cybersecurity resources, they have a hard time mitigating these risks and patching the gaps. One solution could be to invest in resources. Some devices and some equipment is expensive, and it's not easy to be replaced with newer versions, for example, like we do for our laptops. So yeah, resources that could identify the threats and risks would be the first step towards the mitigation.
Okay, thank you. Maria, thank you so much for joining us today, at least remotely. Thank you so much. Bye-bye.
Thank you for having me. Bye.